There are duelling health pledges from Victoria's main political parties as the campaign ramps up ahead of November's state election. Victorian political reporter Simon Love has the details.
Well, both Victorian major parties have been campaigning strong on health, with the Liberals in regional Victoria, Labor in metropolitan Melbourne. Daniel Andrews touring the Austin Hospital in Melbourne's inner northeastern suburbs, where he announced the latest round in a series of grants so that hospitals and health services, 38 of them right across the state, can receive new diagnostic equipment. So that's new MRI machines, new CT scanning machines and other diagnostic tools to assist with the health services.
The need to always be up to date, the need to always do more in these areas, well, that's there every single day, because every patient's unique and every patient should have the very best.
The Austin Hospital has welcomed this announcement, and they say that conditions are easing inside the hospital, with staff shortages due to COVID furloughs also subsiding.
Things are still challenging. I think that's the same at the Austin and all health services. But just over the last 2 to 3 weeks, you would have seen the COVID admission numbers have come down across the state, including here at the Austin. So that's taken some of the pressure off. Having said that, our staff are tired and fatigued, as we discussed before.
The Liberals, though, are continuing their roadshow across regional Victoria, promising to upgrade hospitals, and using that announcement they made last week, redirecting funds from the suburban rail loop into upgrading hospitals across Victoria. They're in Shepparton, and they've announced $100 million for a new life-saving integrated cancer centre, as well as a school, a health school at Goulburn Valley Health.
Today I'm announcing an elected Liberal Nationals government at the end of the year. We'll provide $100 million to upgrade Goulburn Valley Health, new cancer centre, new clinical facilities, new nurses and training facilities. This $100 million announcement is fully funded. It's ready to go.
Meanwhile, the Victorian Greens are out today spruiking its new transport policy. It's been costed by Parliament's independent budgetary office at around $800 million, and it would be to run trains and trams across the metropolitan network every 10 minutes or less between 7 a.m. and 7 p.m. But that plan's been dismissed by the Premier.
Do I think the Green political party are feasible? Really? Not if you want outcomes, if you want commentary.
The Premier criticises it because he knows it's a good policy.
The Greens could play an increasing role in the next state parliament. They currently have 3 lower house seats, and they're targeting electorates such as Albert Park, where the former Health Minister Martin Foley won't be contesting this upcoming election. We've also heard of a number of independents that will be running on November the 26th. They include Kate Lardner from the Voices of the Mornington Peninsula Group. She'll be running in the seat of Mornington.